I'll go ahead and get started. Welcome. My name is Ken Harris, and I'm Executive Project Director and Engagement Lead at the National Institute for Children's Health Quality, better known as NICHQ. And I'm happy to be with our 2021 City Match Conference and serving as your host for this breakout session. And so welcome to the session on fatherhood and men's health. And certainly we've had a great start of the week, right from the White House. Vice President Kamala Harris really launching a historic event, the Maternal Health Summit. And if you attended that earlier this week, you will see that this year's City Match Conference aligns perfectly, all of the wonderful content over the next few days. And so we hope that you're enjoying the conference and wanted to welcome you to this session, which is Innovation in Fatherhood Programming during the pandemic and beyond. And we're excited. We have two tremendous speakers here to present to you today, and we hope that you're excited to hear them. I'll tell you a little bit about them, describe the session a little bit, and then we'll get right in. So first, I would like to introduce a friend and a colleague. It's Mr. William R. Moore. I don't yet know what the R is. I'll find out later. But he graduated from Concordia University, where he majored in history and minored in political science. He went on to work in the St. Paul Public Schools District for about 7 years before moving on to the YMCA to lead their youth outreach programs. William also took part in the National Advocacy Days in Washington, D.C., where he met with various state representatives on Capitol Hill to lobby on behalf of health-related bills, such as Diabetes Prevention Act and the Child Abuse Prevention Act. At Ramsey County Public Health, where he took on a role in chronic disease prevention while being a strong advocate for child and maternal health. And while working with the Birth Equity Community Council, he became one of the first two men in the history of the state to become a certified doula and lactation educator. So you can clap where you are for that. His work has been engaging fathers, making them more integral part of the birth process. He earned honors such as the 2019 Sons of Branford Mentorship Award, and in 2019, the Beaumont Foundation 40 Under 40 in Public Health honoree. So we're excited to have you here today, William. You can tell us more about yourself when you start. And next, second presenter, we have Maximiliano Velasco, who is a first-generation Mexican-American born in California, Anaheim. He is currently residing in Grand Rapids, Michigan, where he works as the fatherhood community health worker for the Strong Beginnings, Strong Fathers, Padres Fuertes program at Kenn County Public Health Department. Maximiliano is a single, full-time dad with found passion in working with fellow fathers to empower and encourage them to be present. And it's really exciting to have him. It's really looking at custodial dads, which we forget about. They're out there as well. So we're really delighted to have Maximiliano with us as well. And we know why you're here. You're here because the current pandemic has really impacted our communities in a number of ways, really shifting policies and practices that have affected birthing plans, relationships, and support systems for families during their birth journey. The impact on fathers has been a significant issue that is not always highlighted. So during today's session, you're going to hear from William and Maximiliano about their initiatives that really support fathers and fathers of color in particular by building authentic relationships with them and building systems that support them and providing really that culturally assigned care and adjusting the needs of fathers during this pandemic. So we hope you will learn about some key strategies that they use to develop father-specific programs, and you'll learn some innovative methods that you may adopt for keeping fathers engaged, and certainly explore opportunities to move in stronger ways to include fathers in this process. So we're excited for today's presentation. I want to encourage you to take notes. Use the chat throughout the presentation. So if you hear things, you have questions, feel free to plop them right into the chat. We have CityMatch staff are supporting us and keeping an eye on the chat. So keep notes, use the chat, and then after they present, we'll look forward to a good conversation that I'll facilitate for us as we close today. So I'm excited to get going, and I know that you are, and so I'll hand it right off to you, William, to start us off, and then Maximiliano can come right after.
All right, good afternoon, everybody. I appreciate you all joining us and taking the time out your day to kind of listen to us speak and talk about, what our passions are in the professional realm. So as said before, I'm William Moore. I'm the Racial and Health Equity Administrator for St. Paul Ramsey County. And I'm also a doula and lactation educator. And with that part of my career, part of my work, I help co-facilitate and run programs such as Doulas for Dads, Club Dad, and I also travel the country consulting with direct care service providers, public health nurses, so on and so forth, home visiting nurses, on how to really engage fathers and men more in the birth process. Because it's a very important thing. I know many of us here have heard the age-old phrase that it takes a village to raise a child, but we continuously perform our work or do our work in a fashion in which we only really equip half the village to do that work, right? When you look out there as far as resources out there for quote unquote families or whatnot, those resources are only there to provide for women and children, or there are resources out there that specifically highlight just being a resource for women out there, and they're not very much there. There isn't there very much out there for men. And that in itself, that issue in itself is essentially the genesis of how I became a doula and lactation educator. While working with the Birth Equity Community Council in Ramsey County, a lot of our community members and direct care service providers really stressed the fact that there weren't that many parenting resources or fatherhood resources out there for the men in our community. And the ultimate goal of what we were trying to do is really address the local disparity in the maternal death rate, where we see Black and brown babies die twice as much as our white babies before the age of 1. And where on a national scale, we see Black and brown mothers die at a rate of 20 to 43% more than their white counterparts. And so it was, that trying to address those two issues and disparities, while also providing resources for the men in our community to be more of a factor in this birth process. It was the idea of a public health nurse by the name of Ms. Tamiko Ralston to become train men to become doulas and lactation educators. And everybody thought that was a great idea, but where are we going to find men who are willing to do that, right? Well, anybody who knows me, they always know that I'm willing to trudge down the territory that nobody else has really been willing to do, or do something that's completely off the books or considered to be quote unquote different. So I volunteered myself. And this training program was in a collaboration with a couple other local organizations, the Wilder Foundation and their iChair program, and also the Cultural Wellness Center out of Minneapolis. And so I, along with another gentleman by the name of Adrian Mack, went through a extensive training, along with, I believe, 8 to 10 women to become doulas and lactation educators. And the idea was, by training men to become doulas and lactation educators, not only could they be a valuable resource to their significant others, their partners, their spouses, but also a resource to other men in the community. To train them and teach them, be a person that eases their comfort in learning about the birth process, so that they can advocate for their partners in those delivery rooms. So they can advocate for those partners when going to, those doctor's appointments, where a lot of our Black women were talking about, hey, like, we're not being listened to, we're not being heard. As I said before, 243% of Black women die as a result of childbirth-related causes compared to white women. We all know that the anatomy of Black and white women is the exact same. What could be the cause of such a huge disparity? Systematic structural racism, right? And so by having another person in there to advocate for our mothers, to make sure that they're being heard, the goal is to save those lives. To having another person in there to ask those difficult questions and make sure that our direct service providers are listening to our mothers, but also helping to retain, all the information that these parents are being bombarded with upon delivering their child. You have two people there who are equipped and able to handle all the information and apply it, so that we can successfully rear our children and make sure that they make it to, past that first birthday. Because ultimately that's what birth work, doula work, is all about. It's about making sure that we're being strong advocates and supports, for our families. I always say families, and stop and make sure to not just emphasize women, because again, doula work or birth work or being a midwife, that's not women's work. It's family work, and family work is everybody's responsibility. And so that's my response to anytime anybody, to anyone, anytime they hear about me being a doula and a lactation educator and say, "Oh, isn't that women's work?" Absolutely not. It's everybody's work. It's family's work. It's my work. It's your work. It's our community's responsibility. Um, but with that work, there's also some stark differences in how I work with men and how I work with women. When I work with women, it is very, very much traditional from the standpoint of making sure that we're going out, that there's some chemistry there. We talk about, their experience during pregnancy. We're talking about birth plans. We're talking about, questions that they, have asked or haven't thought about to ask to their doctors, whether or not they feel comfortable with their provider and need to request another one, right? With fathers, before we can do all of that, we got to do a lot of the emotional and the emotional work, the emotional labor with that. Because the thing is, when it comes to doing this type of work, there's a lot of stereotypical gender roles that play a part in that, right? There's a lot of there's a lot of feelings and emotions around being in the birth space, and not just feelings, but because they come from somewhere. They come from our society's projection to men that, you know what, when it comes to a baby, you're responsible for helping them create that baby. You're responsible for helping to, after the baby's born, pay for them and discipline them. But other than that, you have no responsibility or role in this process, right? So it's funny that in very much a male-dominated world, when it comes to the birthing space, men are rendered absolutely invisible. Nearly invisible. I've had stories from men that I work with all the time about how when they're in the doctor's office, how doctors talk over them, through them, around them, but never to them. And there's been instances where mothers have had to, really check, our healthcare providers and say, my baby's father is here right now. You can ask him questions too. Or he's been asking you questions, but you've ignored. You need to acknowledge, the questions that he's asking you, right? And not only is it the responsibility of our providers to make sure that our fathers are included, but it's also us. It's our localized community and family members that also play into that. And so I always tell people, like it's funny and sad at the same time that a lot of times we get agitated at men and fathers not playing, a stronger role as we would like after the baby's born, when that whole time, up until birth, not only are they getting messages from their direct care service providers that they don't matter, but then you also got family members who chime in, and brothers and sisters who chime in when our fathers are excited about having babies and they're like, we're about to have a baby, we're about to have a little girl, we're about to have a little boy, I'm so excited. And those family members jump in and with their 2 cents, and they're checking our father saying, you're not about to do anything. You're not the one who's having the swollen feet or the swollen ankles. You're not the one having the morning sickness. You're not the one whose back is hurting and stuff like that. Well, what do you think? What type of effect do you think that has on our fathers when they're hearing that message and they're getting that messaging both consciously and subconsciously this entire time? Logically, yes, we know that we're supposed to play, a more vital role in the lives of our children, other than discipline and paying for them after they're born. But when we are, constantly inundating our fathers with the messages that they don't matter, they do tend to take a back seat after the baby's born. And so I'm always constantly talking to our providers and talking to our families about, when we talk about this birthing space and how we're going to care for our children and the birth plans and stuff that we're putting in this place, I always make sure that I address the family as a whole, unless I'm directed otherwise. Unless I'm told otherwise that this person or that person is not involved or not to be addressed. I always make sure that I include everybody. Because including our fathers is vitally important, even from a scientific standpoint. Anybody here which I assume most of you are, who's well-versed in early childhood development, can tell you that the best chance that our children have of reaching all their early childhood milestones is to make sure that both parents are actively involved. Doesn't mean they have to be together in a relationship. It just means that they both should be actively involved. Does that mean that, quote unquote, single parents or parents who are not in relationships, just co-parenting, can't make sure that their child reaches all their early childhood milestones? Absolutely not. But the best chance that our children have of doing that is when both of our parents are actively involved. And that is another vital thing that I think is a part of my work too, because, as being a doula, being a lactation educator, being a birth worker is more about just the birth process and giving birth itself. It's more about, it's just about, that birth, the labor part and the postpartum work. But I think the real work with that is about helping to establish a healthy foundation of co-parenting, which I find that a lot of my clients don't understand too. I was just telling a story earlier to a couple of my colleagues here on the call of how at a conference I had to really have a conversation with the mom about how she addresses the involvement of the father of her children. When at first she told me that she was a single parent, I was just curious, asking questions, and I said, "Oh, okay." I said, "So the father isn't involved, he isn't around, anything like that?" She's like, "No, absolutely. He picks and takes the kids to school sometimes." I said, "Oh, well, he doesn't. Maybe he doesn't provide any financial assistance or anything like that. Not that that is what constitutes a good father or parental figure, anyway. But still." She's like, "Absolutely. He pays child support and he provides any little extra thing that I need." And I had to tell her, I said, "Well, ma'am, you're not a single parent." I was like, "You just don't have a man. You ain't in a relationship at the moment." I said, "What you telling me?" I said, that dynamic you'd explained to me is that of a co-parent. You're co-parenting." And I make sure that I relay that same message to direct care service providers too, as a part of this work, and to both parents that I'm working with. Because one of the things that you risk doing by just using that phrase, not thinking about the damage it could cause, is you risk disregarding the work that the other parent does, who may not be the custodial parent at that given point in time. The fact that they help feed their children, help get their children back and forth to school, homework, all those sorts of things. All those things are very important in making sure that we raise our children and make our children reach all their early childhood milestones. And so by repeating those phrases and terms over and over and over, I tell our home visiting nurses all that time, tell them that, give them that message all the time. You're creating an environment, amongst the parents of resentment that winds up manifesting itself at a different time later on down the line. So where there's a relationship that is typically a normal and healthy relationship, or started out being a healthy co-parent relationship, now there's friction there that shouldn't be there and nobody knows where it came from. It's because all this time, not only are we forcing fathers to fight through this narrative that they don't provide any other way except other than their DNA, financially and disciplinary pathways, but you're not a part of this process even after the baby's here, even providing those ways. Still, even though you're providing those ways in which we deem the baseline minimum, I'm still not going to validate your parenthood or the type of influence that you have in our child's life, because you're not the custodial parent. And so I find that a lot of these things are vital parts of doing birth work, and a vital part, even like I said, even just that language component of making sure that we keep fathers involved and that we give them the credit that they're due. And a lot of times, because we do live in an environment that when it comes to it, we like to render fathers invisible, and that doesn't do anything for the child. When you talk to both parents, one of the things that I do a lot of times when I'm mediating between parents that helps them kind of push through is I always ask them to both of them write down the top 10 things, expectations they have for their children, and I don't let them talk about it beforehand. And the funny thing is, when you read both of those lists out loud, they're actually very similar. Maybe one or two differences, right? And so from that, so what I take from that exercise to help refocus the parents on not their friction, not the fact that they're not in a romantic relationship, but that the child is number one, is you've both just indicated to me that you both want what's best for your children, and you actually have the same exact goals for your children. You might differ on how it is to get there, but you have the same exact goals for your children. how can we make sure that all of our energy is directed towards that and not about, you know, what our relationship status is or what our or how that works out. And one of the things that I think that is missing in a lot of the work is that foundational component when it comes to working with our fathers and working with our parents. Also having the discussion about the trauma that a lot of our men deal with and a lot of our men work with when it comes to being with fathers. You know, I've had to work with men who have, you know, multiple children by multiple women, you know, all around the same age, and women, you know, being angry and upset about, you know, the fact that, you know, that they're in that situation. And one of the things that I think a lot of us forget, even when it comes to, you know, working with our young men who are in this situation, is when we talk about dealing with trauma and dealing with trauma in relationships, when we talk about dealing with trauma, we talk about dealing with trauma through alcohol and drug abuse. But one thing that nobody ever talks about is dealing with trauma through touch. And what that looks like is promiscuity, right? When you're dealing with trauma, you're just trying to fill an immediate need. So you're not thinking about consequences down the line, like STIs from unprotected sex, like having multiple children by multiple women. And I say these things to say, you know, that doesn't absolve them of their actions. That doesn't make it okay, but it doesn't mean it ain't right. Doesn't make it okay, but it doesn't mean that it ain't right. And when I say ain't right, it means like, doesn't mean it ain't true, that it's a part of the things that we're, you know, that we deal with our young men in our community, right? And so the other added part about when we talk about dealing with fathers and making sure fathers included, let's include dealing with the trauma that a lot of our young men and young women are dealing with too, because that will have a strong bearing on how they are able to build a healthy co-parenting relationship for their little ones. Because again, as I'll bring it back to, all parents, every parent that I've ever worked with wants what's best for their children. The idea is, how do we help them get there in a successful fashion? And I believe that is my number one goal as a birth worker. So with that, I'll leave it to my good friend Maximiliano here, and if anybody else has any questions for me along the way, you know, I'll definitely be sure to answer those.
Amazing. Now, to be honest, I get lost in listening sometimes, because I'm like, oh man, that's so. If everything he just said, if a lot of the things that sound the same, just let us remember that obviously there's a lot of the same situations going on across the nation, and this is why we're doing the work we do. Maximiliano, Velasco, William, thank you for that, because a lot of those things just, I felt like, man, I should have gotten a notepad and something to write a lot of those things you said, man, because that's amazing. But once again, yeah, Maximiliano Velasco, Strong Beginnings, Healthy Start, Strong Fathers, Padres Fuertes project here in Kent County, Michigan. We reside here in Grand Rapids. Super excited to be here. I've been doing fatherhood work for the last 3 years, and just it's amazing to be able to be in this field precisely. So just want to start with saying it is easier to build strong children than to repair broken men. Frederick Douglass. And it's crazy that the last 2 jobs I've had, this is like this is the standard. And it's like, all right, everyone's got a lot of the same ideas. And so I love that. But one of my favorite quotes is, any man can be a father, but it takes a special person to be a dad. But we also got to remember that can also reflect with our work. Anyone can do this type of work, but it takes a special type of person to do this work intentionally. And so hopefully that sticks around, because I'm just one of 3. For those who know my colleagues, Adnonis Bo Torres and William Perez, and myself are the ones doing this work here in Kent County. Super excited to be able to be doing this with both of those gentlemen who've been doing this work for years now. And just excited to learn from them. I actually interned, just to give a little feedback, I interned here when I was starting my college lifestyle and all of that. So it was really exciting to have those gentlemen help me out and now create a full circle and me working in this field. But more importantly, what we do here at Strong Fathers, Padres Fuertes, to a lot of the things that William just said, right? Infant mortality is our our biggest concern. The percentage in our population here in Kent County, for the stats that we have, it's way too high for our Black and brown children. And this is the work we're doing. And just hearing that that's what's happening in Minnesota, and this is why what William started with, it shows a lot of what's going on in our nation, not just in a few states, right? And so it's super important, the work that we're doing on a daily basis. Just to give a little bit of feedback on what we do precisely, education is on topics like men's health and healthy relationships, ideas on how men can support their partners throughout their pregnancy and after their pregnancy, information on the child's development and then making sure that we're hitting those milestones, helping with getting transportation, housing, right? The social determinants of health, right? All of those 5 points that allow the family to be built in a better way. And then helping building life skills. All of these contribute towards creating that family environment. And sometimes, like William mentioned, you're not in that family environment anymore. Now you're co-parenting or doing that single parenting. It's important to have all these skills under your belt. And that's my favorite part about this work, right? Being able to say, hey, we're walking alongside you. We're learning from you as much as you're learning from us, and we're creating these skills together. And so a lot of the work that we do now has been able to be moved through social media just because of COVID-19, right? But it's super important to understand how to do it and how to properly navigate yourself through that. Knowing that not everyone is used to this social media stuff, knowing that everyone's not into getting too much into Facebook and all these other apps that we tend to get ourselves in. And just because I know I don't have my presentation up precisely, because this usually it takes an hour and a half for us to give our presentation. The focuses of our work started in around 2016 at Strong Beginnings towards that fatherhood side. A little bit earlier was a few practices, but in 2016, we were actually a lot more based down. But the main point was, how do we support our fathers in a community that doesn't feel like there's not enough support, right? You go up and down these streets here in Grand Rapids, and you'll see 1 to 2 spots that say supported women's health centers, pregnancy resource centers, all of these great spaces for moms that, as a father, right? You come across these places and you're just like, I shouldn't even walk in here. It doesn't even feel like they're gonna be supporting me. And so, to me, coming into this role in the last year and a half, it was, how do we make our name out there just stay recognizable, staying up? How do we get our name in places that a lot of men don't really hear about it? And that came from experience. As a single full-time dad, to William's story, being that single parent in the home, having to navigate my child's life, my life, and all these things. It's how do I find support? When I was working through all that, it was super difficult because I didn't feel like there was. And even interning, I remember telling Bo, I told Bo, I'm like, hey, where were you 3 years ago, man? I needed you. I needed you to help me navigate through the court system. I needed you to help me navigate through the child support system. And I didn't feel you guys were there, but they were. It just wasn't being promoted like it should. It just wasn't being exposed to community like it should. And so with that mentality, coming into this work, that was my main goal. How do we create this to be something that is just known about in our community, where gentlemen are reaching out to us instead of us having to recruit gentlemen, instead of us having to, no, they already know we exist and they can come to us with any questions. And so that's been our plan since COVID-19 started, knowing that, community was going to be in need and knowing that our fathers were going to need services. But not just that, right? How do we support our partners? How do we support, to William's point, how do I know I'm not going through all these body changes. So how can I advocate for my partner? And so having all these trainings that we do using curriculums like Fathering in 15, 24/7 Dads is something we integrate into our project. And it's just been super helpful, even for myself, right? As a growing man and still educating myself, it's always that give and take. But one of the main objectives as well for us has been being able to grow the emphasis on fatherhood. Not that long ago, we had an opportunity to meet Jason Wilson, right? The man who wrote the book, Cry Like a Man. And he actually mentioned something that was very impactful. He said this fatherhood work has only been done properly probably in these last few years, but has only started about 20 years ago. So it's very historic what we're trying to do in fatherhood, changing the culture, creating a new environment for the idea of fatherhood, and then uplifting that future, right? Making sure that we're not just changing lives, but saving our babies' lives. And so with all that being said, our project has been able to function in a way where now we're creating a newsletter that's meant for fathers, that's meant to be read and meant to be looked at as, okay, fatherhood is real, fatherhood does exist, and it is beautiful. Every time I went to an OBGYN office, it was a Sports Illustrated, and that's not all we are, right? We're not all just sports. We're not all just, where there's more to us than that. And I think it's changing those biases, changing those ways of thinking, and even then changing the way that community thinks of men and fatherhood in general. And so creating educational spaces like Manhood Monday, which was given to us an idea a few months back, and we were just able to develop our own way of doing it. Creating those engagements throughout COVID, because we're not able to do our donuts with dads. We're not able to get out there. And so we really use the capacity of social media to help us out here at Strong Fathers, Padres Fuertes. My favorite part about this work, though, I am not gonna lie, it's being able to see a dad and asking him, how are you doing? That goes so far. When you and your partner are pregnant, the majority of the time is, oh, mom, how you feeling? What's going on? What's the diet looking like? It's all the questions is to her. And to William's point, no, we don't get the swollen feet. We don't get, every once in a while, some of us will go to the bathroom in the morning because we got that morning sickness, right? You got transferred. But our mental health is the one changing. Our mental capacity is the one having to figure out, do I know how to be a dad? Where are the instructions on how to be a dad? So maybe we're not going through the physical changes, but we go through a lot of the mental and spiritual changes. And that's where I feel it's super important for us to come in. Because I'm actually one of the first times whenever I go do my home visits, it's a lot of those times where, hey, how are you doing? And that was the first time someone asked them about the pregnancy part. How are you doing through all this process? That was the first time they heard it. And it sometimes makes me sad, and it also it encourages me to do this work, because our mental health is the one that goes through it. If the partnership ends, the romantic side of the relationship ends, it's going through all these realms, and we still don't get asked how are we feeling about things. Now we're feeling overwhelmed. So all these things, and that's why I loved when William said, it's changing that perspective, because we want to make sure we're there for our fathers mentally and spiritually. Our fathers are brown and Black fathers who culturally growing up, we were raised a specific way to that gender norm way of thinking. And so it's creating opportunities of experiences to our fathers that allow them to question their growth and their culture and say, oh, what? Were my parents probably, yeah, they raised me great, but I can do better. I can be better. And so being able to do this type of work, the importance of what our voices allow us to do, not just uplifting our fathers, but allowing them to be present in their children's lives. It's super valuable for our children, right? It's valuable for our children. And so to think, and I think it's something that I wasn't as aware. William doing a lot of the work that he's doing in Minnesota, right? That's miles away from where we are, but yet the correlation of infant mortality is there. And so how is this not just a state problem, it's a nationwide problem, and how can we work together to making sure we're hitting the nail in the head. We use a lot of our community partners to make sure our voices are being heard. We have projects like MAPFI, where we're trying to do statewide changes when it comes to policy. And I think it's super valuable now to hear, right? Child support is taken in consideration. You pay on time, we're gonna help you with your credit score, because those are opportunities that should be given to our fathers. And so creating policy changes, creating educational opportunities is what we thrive to do here at Strong Fathers, Padres Fuertes. And so, but to know that William and their colleagues and Kenn and I've been able to be in a lot of other groups where National Healthy Start is being able to bring all of these projects together, it just puts a smile on my face. Because a few years back, I swear I wasn't here of a lot of this, and now being able to work in this type of environment, it really gives a lot of pleasure into my everyday life. One of our one of the things that we really try to change now was bringing in that Latinx community more intentionally, especially in a city like Grand Rapids. For those who don't know, no matter how diverse it may seem, it's still very, and sorry for the term, I hate, but it's so true, it's super segregated here. And so being able to create spaces where our Latin fathers can feel comfortable going downtown, going into the outskirts of our city. We still have a lot of the legal situations that we deal with. And so taking away those fears, taking away a lot of the way of thinking that we're feeling attacked or we're feeling like we're not wanted, is some of the things that we really try to accomplish here. And so with a city like the one we have, and again, advocating for, you need to voice up in the hospital. You need to speak up when it comes to your spouse, when it comes to your partner. Maybe you guys are not together, but she's letting you know she doesn't feel comfortable with who's taking care of her afterwards, the doctor she's seeing, and being able to be present. All of that has so much value into even how our children see us as men, into how our children see us as fathers. And so going back again, the social determinants of health being our blueprint, but us being able to say, hey, these are a lot of the tools, these are a lot of things that you need to have in your pocket and have it ready, because eventually you might run into something that it's up to you to make a difference in. And so super grateful to be here though. I know William, I don't want to overspeak a lot of things you just said because it correlates so well. And I guess I should have done a little bit more research on all the work that's being done through your end. And but it's super amazing to see that we're not the only ones doing it. It also does, and hopefully, a lot of people feel encouraged. The intentionality of our work matters. In every step that we take towards making sure that we create spaces and we're creating educational environments, that they are intentional, that they do feel welcoming. A lot of the things that we try to do here is making sure we have posters that have fathers in the background in our schools, posters of fathers in OBGYN offices, making sure that male presence is not just in a spiritual matter, but in a physical matter, it's there, it's being shown. And so we want to continue to contribute in that way, not just to our fathers, but to the community itself, educating community and letting them know, hey, this doesn't seem fatherly inviting. It doesn't seem like men would want to come into this room, right? And so we want to make sure we're not just creating that education for our community, but for those that work within that community. And super exciting to be able to hopefully answer a lot of the questions that are going on, because I see a lot of things, but that's just a little bit of what we do here at Strong Fathers, Padres Fuertes. I wish I was able to show you guys all. exactly what we do on our social media page, because we are limited to 0 to 18 months. That's who we aim to support and educate. But that's something that on our social media page, we want to say, no, we don't limit that. We want to make sure that the education and everything is available for our fathers within our community. But I'll let you take it, Ken. Once again, thank you all. We appreciate the opportunity.
Well, first, let me just say wow to both you, Maximiliano, as well as William. I think dynamic presentations and lots of information. And so we do have some questions in the chat, which we'll get to you guys. But let me just say this first and foremost, for someone who's been around for a long time, it is great, and I'm sure our attendees today can appreciate this, what you and William represent, like this new generation of fatherhood advocates and family advocates, I would say, because of your understanding that each of you have that this is about the family, it's about the child. And so it's nice to see this new generation of fatherhood advocates and family advocates. So thank you for that. Both your comments for me had my mind going back about 30 years ago, because it was the March of Dimes who really started looking at father inclusion. And they had a whole campaign called Men Have Babies Too. And when you're talking, Maximiliano, you used that term. And so that's what made me think about that. And again, William started it off when he started speaking. So again, thinking about how do we include fathers in this process? And as William said, pregnancy is about all of us, not just her. So great stuff. And so I'm going to start with these questions, and we'll get some other comments from you guys in between. But if we could start with you, Maximiliano, just to connect with what you were saying. People want to know if you can talk a little bit more about Manic Monday, and then also how you're using social media to engage fathers. Okay, and both of you probably can speak to that. But I'll start with you, Maximiliano, about Manic Mondays, and then the social media piece, and then William, if you have something to say too on that.
Yeah, so it's Manhood Mondays.
I say manic?
Yeah, no, it's good.
Sorry.
But yeah, so again, I was called one day. They said, hey, the opportunity came up. Would you like to work with us? I said, this was my goal. My goal was to come back to Strong Fathers Fuertes after interning, but it took a few years. Coming in, it was the middle of COVID, and COVID had caused everything to close down, right? So in-person engagements were shut down. That kind of put us in a tight spot when it came to National Healthy Start in general, our program in general. How do we create more opportunities of education, and how do we utilize what we have? And I remember I told Bo, I'm like, you guys stopped doing these a few months back. Let's bring it back, but let's do it differently. Let's not just talk about FOC, because we're not just all about Friends of the Court. Of course, we want to educate that, but my idea was, let's talk about love. Let's talk about co-parenting, literature. Let's talk about goal settings and stuff like that to the public in general. And so the Facebook page was already up, and I thought, and it's funny because I did it out of the blue with Bo on the side. I'm like, we should do a practice one based off politics. During that time, it was 2020, all the voting was happening. And so the Manhood Monday was created not created, but just evolved. We evolved it into what it is now. And I'll make sure to put our social media URL in the comments, in the chat box. But the Manhood Monday is meant for everyone and to the public, but it's meant towards that father, towards men. And towards even then young men who are going to be developing, right? They're looking towards the future. And we really have, I try to invite a lot of men who are already doing a lot of the work that is being done here in our community. So we have special guests. And so the Manhood Monday really brought back that concept of we're missing that Donuts with Dads. We're missing, we had a few years back, we had barbershop talks where we would go into a barbershop and have conversations with our dads. That's not here anymore because we can't do that in public. And so the Manhood Monday was a huge opportunity for us to create that engagement, not just for our fathers, but also for community. And it was super, super amazing to be able to say, hey, we're back. Not in person, but we're back, and we're able to, our highest views was 1,000 people that in our community that was able to show up, and they'll pop up questions and comments while we're doing it live, and then it's just there. So if someone missed it, they're able to go back and rewatch it. But yeah, that's what Manhood Monday is, and that's one tool that we've used through social media to navigate through this COVID-19. You're muted.
Still muted.
You're not there. I think you were next though, Will.
So, all right, yeah, so I'll go. So we have something similar to that. It's called Club Dad, and we meet, and in Club Dad, we meet, once a month. And I like to describe Club Dad, really, to be quite honest with you, is just a space where men can come and feel safe, feel comfortable, develop relationships with other men, get resources on furthering their education, mental health resources, get resources on parenting, fatherhood, on how to get gainful employment, stuff like that. But more than anything, again, it's a space where men can come feel safe and talk about the things that ail them. You know what I mean? We got a lot of brothers who live in a community where, to be quite honest, how are you going to focus on really being a father and being the best father and partner you can be if you're not sure you're going to come back home at the end of the day? Right? Let's just be real about that. Let's have the reality of that. And then as a man, you're groomed and taught that to have conversations about feeling worried about that, being vulnerable with that makes you weak. And when somebody, and as a man, when you're taught that you are showing or displaying weakness, that furthermore heightens the paranoia, because now you feel like a target as soon as you step out the door, right? And so creating a space where we can let these things go, because I can tell you, as far as mental health is concerned, especially as a Black man, and people can tell you this too about early childhood development. When you don't allow children to process their emotions, to go through those early childhood development stages, my dad always says the two things in this life that are undefeated, time and nature, they always win. You don't allow that young man to process his emotions, to deal with those emotions, be vulnerable, know how to function in that capacity. It's no wonder to me, and it's not confusing to me when I get a grown man at 30-some years old and his partner tells me he acts like he's 12. Well, guess what? I bet you if I hear his life story, he wasn't allowed to process those emotions and be a 12-year-old when he was allowed to be a 12-year-old. Again, doesn't make it right, but don't mean it ain't true. Right? And so to provide an environment where men can come and be vulnerable and have those conversations and let those mental and emotional stresses out allows them to have that outlet. So then when they go back to their homes, they can actually be a productive partner, right? They can learn strategies. They can be vulnerable to their significant other. They can be that vulnerable and sensitive father that their children need them to be. And again, once again, our community as a whole, because it isn't always outside institutions that are blame. Our community as a whole also bears that responsibility, right? We can't have folks out there have a community. I've had to tell some of our young ladies in the groups before, you know what I mean? You can't have your man talking about you want your man to be hardcore all the time. You want him to be like Tupac. You want him to be this big hardcore cat that can't nobody knock over and all that type of stuff. But then at the snap of the finger, when you need him to be sensitive, he's going to be sensitive. Your community and you are grooming him to be hard all the time, right? So it's a learned behavior. He has to learn that, right? And so our environment at Club Dad is an opportunity for him to learn that behavior of how to let it go. Sometimes, bro, you got to let it go. Come vent. And it's a space where we're all learners, right? Everybody's learning from everybody. There are gentlemen of all ages. We got, you know what I'm saying, like young men who attend who are 17, 18 years old, new fathers. We have 40-year-old men who have been coming who are multiple fathers, and to see that exchange between them, right? And the delivering of the knowledge to one another is huge, right? Because what you see is this real cathartic environment where information is being passed around from generation to generation, even though the bloodlines aren't connected, right? It's somebody who is in their 40s, who's made the mistakes, been there, done that, saying, I hear you, young fella, but this ain't the way you want to do it, right? So I'll give you a prime example. I remember one day a young brother came in and he talked about how him and his baby's mother, who he's co-parenting with, were not having it. They were arguing, fighting all the time, and they were fighting. So me and another older gentleman in the class asked him, well, what happened? What's wrong? He said, I don't know, man. We was just asleep. And in the middle of the night, she, you know what I'm saying, she woke me up and started yelling and was fussing and yelling in my face. I don't know what it's about. So once again, me and the older guy, we asked him, and I'm in my mid-30s. We're like, so you sure you didn't do anything? He's like, yeah, I'm sure I didn't do nothing. It was like, you 100% sure? He goes, yeah. I said, and then one of the other older gentlemen chimed in. He's like, listen, young bro, I've been in this a long time. And he said, I'm gonna tell you right now, even if you didn't think you did something wrong, she think you did something wrong. And it ain't necessarily, that doesn't mean that it's about his fault or her fault. It means y'all need to have a conversation. Communication needs to be key right here. And I told him that too. I said, yeah, I'm gonna tell you right now where I could tell you that I have issues with your story. Is you say y'all both woke up out of the blue and all of a sudden she was arguing and fighting. I said, no, you woke up. She been up for about 15, 20 minutes thinking about how she was gonna approach you about whatever it is that you did or didn't think that you did or didn't know that you did that she's got an issue with. And through the conversation and like that opened the floodgates to having this conversation. And we were like, bro, X, Y, and Z happens. You hear what you just told us? That may be what your issue is. Don't you think you need to have a conversation about that? He's like, yeah. And so without having that environment and for him to feel safe and we go this conversation out of him, he leaves the he would leave that room and would have normally left that conversation just thinking that, the mother of his child is just upset for no reason and wilding out, when that's not the case. She has a valid reason to be upset. Y'all need to communicate about that. And if it's something serious, y'all can either agree to get the help that you need to work on and move through it, or to go your opposite direction. But you need to communicate about that. That would have never came out, and it would have just been another situation of a young brother stereotyping, the mother of his children as being this quote unquote crazy woman who was just upset and he don't understand her. It wasn't the case at all.
So William and Maximiliano, let's do this right now, because you both have spoken to creating this space for men and utilizing even this the internet or this social media to do that. That's great. And I think that's a great point for our attendees to get. But I would love to ask, there's a lot of people here, and I know my colleague Kenn Scarborough and I created this core adaptive model for fatherhood. And in our research, one of the core things we identified was what you've talked about, and that is, if you, at minimum, create space and place for men and fathers, and what both of you have agreed to that. So I would like to ask you all that in attendance today, just to utilize the chat now with a yes or no. How many of you have done something like that, created space for men, whether it's a club dad or a manic Monday? Because I know people around the country, Louisiana does something like this with the men and fathers. So if you have, just put yes in the chat. And if you have a name for it, feel free to share with your colleagues the names of the type of spaces you've created for men and fathers. And again, hopefully you can take some of the ideas you've heard from William and Maximiliano on how to do those. But another question I'll start with you, William, is how do strategies change if there is a history of intimate partner violence? And we know in MCH that is a huge issue. So how do strategies change when that is present? What would you say?
I would say the big thing is know your role. Don't try to do something that you're not qualified to do. And this is where it's important and incumbent upon all of us, like to stop siloing our services. And you go to a lot of different organizations, everybody talks about how things are siloed, but very rarely do they do anything about it. I have connections and I have resources that I can call on hand who handle this thing specifically. I'm on the board of directors of a domestic abuse shelter. I know therapists, different individuals like that, where within conversations with a couple, if I sense something like that, I can have those conversations about, if there is that type of physical abuse going on, whether they feel comfortable talking to me about it or not, here are these resources for you to provide. Now, if it's something that I feel is like super dangerous and there's like an imminent threat on hand, then that's where it is upon me and my responsibility to call the authorities and at least make somebody aware of that. But preemptively doing something and not knowing you're really stepping out of your lane and stuff like that, and telling people to do stuff that you're not qualified to do, you can get people hurt. Because the bottom line is, we don't know what these folks are dealing with when they leave us. When they're not in our offices and when they're not in our space, right?
Yep.
There are folks who are dealing with, who don't control the finances. right? So they feel held hostage about that. There are folks that, you know, emotionally terrified. And so more than anything, it's important to have and build that relationship where they feel safe to come to you and to be able to, you know, have those conversations with you, but then also know that they can come to you for resources when they are ready to make that move away. So I think that that is the huge part about it.
Yeah, so know your role. And then again, I like what you said, you have access to resources, connecting to the right people that do this, that's their lane.
Exactly.
That is so critical, because as you said, you could get people hurt, but you can get hurt yourself, because I've heard stories too, that retaliation when you've messed something up. Yeah, so good.
Because I've heard people plenty of times, you know, in situations from the outside, looking at, well, why don't you just leave? Why don't you just do this? Why don't you do that? And I want to tell these people, how many times have you stayed into something longer than you should have? How many times after the fact did you realize that you should have made a different choice and you weren't able to do so, right? And when you have kids, that's an added component to it. And then let's be quite honest too, to take it one step further. In this day and age, where police violence against Black and brown bodies is so extreme, and something that they're worried about, there are literally, I've heard Black women say, I'd rather deal with what I'm dealing with at home to get my child's father killed by calling the police, right? And so we got to be cognizant of that too. And so to not think about those things and take those things in mind is to be intellectually like arrogant, and to be quite honest with you, ignorant of the realities that a lot of people in our community live.
Yeah. Maximiliano, do you have anyone to add to that about the intimate apartment violence? Anything you want to add?
Once again, it takes a very special type of person to do the work we do. I'm gonna say that because, to William's point and his story, right? If that young man did not have that environment, where would he have gone with those emotions? And what words would you have heard from just friends that, oh yeah, she's crazy, man. Oh yeah, she's, and they start approving your man, she just attacked me for no reason, right? All these things that William and the other gentleman was able to, hey, wait, think about it. What did you do? All those are strategies. Those are strategies being given to him. The same strategies could have been given to him in another environment in a whole different way. And so why these environments are super important to have sometimes, because these men are looking for that support. These young men are looking for someone in the back to say, hey, don't do that, or hey, this direction might lead you in this direction, things to experience, right? And so having these spaces, first of all, to all those who said yes, they do have these spaces. It's amazing to have those spaces, and I hope you all have, whoever is leading those spaces, they're doing it in a very intentional way. They do have the resource provided to them, because those resources are important. But not just that, right? The importance of these spaces also, because I do have that space available for me, but I also have friends and family and their ways of thinking. And to William's point, right? Oh, they'll give me that advice, bro, just leave her. She's crazy. But then another group is telling me, hey, you can fix this though. You can figure this out. There are steps you do need to take, hard steps, but they're super important for you to take. And so having this environment is super, super valuable. Go ahead, Will.
Yeah, I was just gonna like kind of chime in with that too, and especially in regards to like a question I kind of seen pop up in the chat earlier, and it was talking about how do you get men or people in spaces of which men aren't normally welcome and invited to be open to men being there more in a more earnest fashion. And so there's 4 questions that I ask, especially I pose it to my men's group, but I also let the people that I train and facilitate, the professionals that I work with, know about. And these are these key 4 questions, because with me, it's all about, first of all, you got to be able to open their minds to the possibilities. Because again, when you are conditioning and training men, but not just men, society at large, that men only fit into one category or section or box, that's what people go off to think about, and that's that unconscious bias that we carry into our work all the way, right? And so there's 4 questions that I ask, and I ask the group of men. I go, I'm like, what is your definition of manhood or masculinity? Everybody gives me their definition of what manhood or masculinity is about. It's usually very stereotypical, right? I'm a provider. I'm tough. This, that. I can move how I want, do how I want, whatever. That sort of deal. Second question is, where did your definition of masculinity come from? Starts to get a little bit more interesting now. Sometimes it's maybe a dad in the house, maybe it's a TV show, maybe it's the coaches, maybe it's people in the street, in the neighborhood, maybe it's a grandfather, uncle, whoever. Maybe sometimes maybe it could be mom, whoever. Third question is, and this is when it gets very interesting. Does a person that gave you that definition of manhood or masculinity live up to that definition themselves? Now you start to see people get real quiet, and you start to see people really, you start to get that glance up into the left, like they're really processing stuff in their brains, right? Because then you start to get the answer of, nope, the person who gave me this definition of masculinity or what man is supposed to be like, they don't live up to that. Because what I've learned about human beings are, we like to place limits on others that we have on ourselves. If I can't do this, if I can't achieve this, if I'm supposed to behave this way, then that's how somebody else is supposed to function, right? So then the fourth question I asked them, if you just told me that you're a man and you can do what you want, how you want, whenever you want, then why have you just basically laid out to me that you've been displaying what manhood or masculinity is by somebody else, by somebody else's standard who doesn't even live up to that themselves? Basically, you haven't even been living your own life. You've been living somebody else's life.
Mm-hmm.
Then all of a sudden, it's almost like you can hear the air leave the room. Because now a whole lot of other things become possible, right?
Mm-hmm.
When I've just now identified that I haven't even really been living for myself or behaving in a manner that I deem to be true to myself, and that it's okay to live outside of that paradigm, now different things become more of an option, right? Now it's okay for me to get up in the middle of the night and feed my baby, right? Now it's okay for me to change diapers. Now it's okay for me when, when the mother of my child is going through postpartum depression or whatever, or just too tired because she's been up all night. It's okay for me to get in the kitchen and cook and clean, right? Now all of a sudden, those no longer become feminine jobs, and the whole gender role,
The gender norms,
the whole gender role paradigm shifts. Because now I realize, why am I doing something that somebody else told me to do and they don't even do it themselves? But I say I'm a man. I say I'm supposed to be able to do what I want, when I want, how I want, right? That's how I start to open up the room and open up the possibilities for making it to be okay for men to be in that space. It's really about allowing them to make that decision themselves and just showing them that there are different possibilities.
Mm-hmm. Yeah, and I wonder how those questions would go talking to a female or maybe a worker within the space, because those are great questions. So this is what we're going to do, William and Maximiliano. I'm looking at the time, and I'm looking at some great questions here. And even Mary Glidden, she's pretty smart. She has 2 questions instead of 1. So what I want to do, I'm going to go through these questions, but I want you all just to give me like a close to 30 to 40-second responses so we can get through them. And let's do a little rapid fire, because we want to honor these questions that folks have asked. And again, the commentary has been wonderful. But William, right to you, can you share more about how you talk with nurse home visitors and others in Ramsey County? Many home visiting programs for pregnant women are geared towards the pregnant person. How does staff respond? Any additional suggestions about including dads in the visit would be great. So what would you say, sir?
First of all, have the conversation with that leadership and get rid of them charts that y'all bring to the meetings, the first couple of meetings. It ought to be about relationship building at first. And the reason that you get superficial information and folks don't really open up to you is because you come in, they see the clipboard, they see the paperwork that they got to fill out, and they instantly feel like a client and another number. They don't feel like somebody that actually cares about them, wants to build a relationship and help them. Once you're able to build that relationship, and all, like I said, until told otherwise, ask about a partner, ask about a father, include them, then things won't change. But you gotta come in and stop treating people like numbers and going by those charts all the time. That chart shouldn't come into like the 5th, 6th, maybe 7th meeting until that person feels comfortable and maybe they ask you about it first.
Well, I'm gonna say wow to that, because I said come strong, and that's nice and strong. It's real good too. That's clear. Max, Amelia, you say anything? Go ahead.
No, it's the intentionality. The intentionality behind you has to be there. And so, yeah, to that point, Will, at all my community health work meetings, we're having a phone call, we're having a conversation. How are you doing? How are you feeling? What do you do for a living? Because this is what I do for a living, but I want to get to know you and get to know me. Get to know me a little bit, because I want you to understand that this is a give and take. For when it comes to the nurses, I as much change we want to create, it's also training from up there that has to be changed as well, right? Those bias changes, the trainings just need to start developing and evolving to what society needs.
Yeah, so relationship, authentic connection, awesome.
Has to be.
So how do you sell this idea, the importance of men and father in a space where those concepts aren't typically expected or even welcomed?
How do we change those concepts, like in
the importance
like
of men and fathers?
Okay.
Yeah.
So I can do that real quick with a very quick narrative. Promise it won't take long. So I had a situation where I had a young man come in and he was talking about, because all of our organizations are talking about rebuilding of families and making families a central piece. Well, I'm gonna show you why it's important to have the dad a part of that. Young man comes to me and he talks about how his quote unquote baby's mama is different now. He doesn't know if it's gonna work, different stuff like that. So I started to ask him a question. I said, well, how long have you been with your quote unquote your baby's mama or whatnot? And he said, oh, about 5 to 6 months. I said, how often did y'all date? He's like, oh, we used to hook up every now and then, a couple times a week or whatnot. So it's like, oh, so you used to hook up a couple times a week. I said, well, let me ask you this. I said, it might be quite possible that she's changed. When women get pregnant, they go through biological and chemical changes. Sometimes it works with changes their emotions. He's like, yeah, I think that's what happened. I said, but I bet you didn't know that when a man gets a woman pregnant, he also goes through these same chemical changes, right? He goes, wow. I said, yep. So I said, maybe, just maybe. I said, it could be her that's changing, or it could be you changing, and she's actually feeding off the energy you're giving off. And he said, wow. He said, I didn't think about that before. I said, I'll even go one step further. I said, it could be neither one of those. It could be the fact that you guys are never even in a relationship. You've just been hooking up. So now that she's pregnant, you're spending more time together and you're finding out stuff about each other that you just don't like. Because the other added component to that, what a lot of people don't see, is a lot of our young couples out there don't even know what a real relationship is. They don't know the difference between a symbiotic relationship, a parasitic relationship, and just cohabitating. And what's wrong with that is when we're just cohabitating and there's no love, our children model the behavior, we model the behavior for our children. And so when we there's no love in the house and there's none of that there, and we don't know what a real relationship is. Little girls grow up to get in relationships with men who don't know how to show love, and they stay in it and they stay miserable because they think, oh, well, he doesn't beat me, he doesn't mistreat me, so this must be right. And our young fellas get in relationships, don't know how to show love to the women, and they get frustrated that she keeps nagging on him about, you don't love me, you don't show me that you care, when in his mind, the fact that I'm here and I'm paying for stuff shows that I must care, right? And so that's why it's important to make sure that we're involving fathers in there, especially in the early stages, and building that foundation of what a healthy co-parenting relationship looks like and a relationship in general.
Good. So where do you find the best ways to reach dads in the community and engage them? And how do you break the mindset that many dads have that dad's job is to create a baby, pay for the baby, and discipline? So where are the best places to reach these dads in the community, and how do you address their mindset that they have? Why don't you start, Maximiliano?
I mean, they're everywhere. I'm gonna say that right now. I mean, if we're talking where we, the majority of us as men, where are we? Barbershops, right? Sports complexes, or whatever you want to look at. But we're everywhere. And I think that's something that's just missed. Are we that overlooked that you don't really see us in every single space? Because we are in every single space. And so it's, how do I create that environment where it is inviting? It is like, oh, you heard the name, but there's support here for you. With that being said, though, it's the words I use, the way I approach. Am I bringing in experience or am I bringing in education? How am I doing it? Our young men, in my history, right, as a Latino male, it was very hard just to look for support, especially when I had to dig through it. To dig through support, I'd rather not waste my time and just step into the courthouse myself. And that's what I did. The thing is, the support was out there. I just had to dig through it. I shouldn't have to dig through it. There should be support out there already just present for me. It should be visually available in every aspect. I should be able to go to an OBGYN with my partner and see myself in this space.
Mhm.
Because I need to ask in 2021 to see myself in the space, that's just nonsense. And so how do we create, right? We go to schools, we say, hey, here's a few posters of a dad hugging up their daughter and of a dad reading to their child. Here's the OBGYN, we're dropping off our newsletters because we want there to just be more than just Sports Illustrated. We're not just this. And then the education grows from there. But really it's that approach that we give, that approach is super important. Am I being inviting towards men? Am I being inviting towards father? Because to think, and you get that a lot. Where are dads? Like, where can we find more dads for our project? What effort are you doing towards finding more dads for your project? What type of words are you using? And so it's super important to value that words and the way we present ourselves is what's really going to invite them or not.
Stop asking them to come to you and you go to them. Everybody thinks
Yeah.
authentic community engagement is tabling at an event, national night out, or being outside in the community with your badge on from 9 to 5. Real community engagement is going to where people at, not expecting them to come to you and not waiting till some event to set up a table. Go to where folks are at. Go to the grocery stores where people at. Go to the play. If you can't go to a community and you don't go to the same grocery stores as your target audience, if you don't want your kids playing in the same playgrounds and stuff like that, that should be a serious question you need to ask yourself why. And after you get to the reason of why you don't want to do that, that's the reason that you should be trying to fix, and you should be working around that obstacle to make sure that you reach the individuals who you see as your target audience.
Yeah, and I love what both of you have said, and also in your presentations, you talked about, again, the specific populations, them Black and brown men, African American, Latino, Native men. Again, it's important to understand the history of exclusion before you move to inclusion. So people think it's an overnight thing. I set up a nice table, they're coming in, and then they don't come. So what you're saying is so important, but understanding the history of exclusion, because that's what has rendered them invisible and unvaluable. So we have to address the exclusion, and then I think we'll have better inclusion. So
you have to. And then with the realization too, like all of you need to think about the fact that like we all represent institutions that historically have created the disparities in the same communities that we claim to go back into, saying that we want to fix. So if that's the case, our community members know that too. They're not going to just come to you. You have to go to them. You have to start holding meeting spaces in their spaces. You have to start asking, can you be in their spaces? Can their barbershops, their local rec centers and stuff like that to hold these? And you can't be discouraged just because you hold one and 1 and 2 people show up, because then when you leave, that shows that you're not serious. What people do respect is consistency about what you're trying to do. And so if you show up time in and time out, even when there's only 1, 2, 3 people there, eventually you'll start to see 5, 10, 15, 20 individuals show up because you've been consistent and you continue to show up and you meet them where they're at.
So I heard messaging. Yeah, go ahead.
I'm sorry. No, to that point, Will, our Manhood Monday started with 7 viewers.
I went to 1,000 one day. Yeah.
Once a month, consistency, because we wanted people to know we're here. We are here. We're going to continue to do this. And then it went off to 100, 200, 300. It kept growing because people saw that consistency. But again, the intentionality behind our work has to be there. If we're not intentional about what we're trying to do here, and that intentionality, that the main point, right? That infant mortality point, we're trying to save lives, but through trying to save our children's lives, we need to change our fatherhood's lives. We need to start changing our community and the way we think. And so, that intentionality has to be there for when we're approaching our families.
Yeah, and just wanted to lift something up before I go to this next question, but responding to your comments earlier, William, Jessica Bowley said, she recently had a conversation with, and this is when you're talking about mental health, trauma, et cetera, but she said, I recently had a conversation with my father-in-law who was dealing with some mental health issues and felt he wasn't allowed to be vulnerable and cry. Thankfully, he felt our home was a safe place, a safe space, and that emotions were allowed. So again, both of you are back to emphasizing that creating that safe space. So I just wanted to lift it up because that's really, really important when it
Right.
comes to working with these men and fathers, because they are vulnerable. Maximiliano started with Frederick Douglass's quote, but that's, these men are fractured and hurt and injured, and nobody wants to take care of them. They just want them to perform. So this is really important. But let's go back to pre-COVID, you guys. What strategies were you using to engage fathers that were successful? So before COVID even hit, what things were you doing that were really successful?
Old-fashioned feet on the pavement, going out, recruiting people. That's stuff that nobody really wants to do right now because it's not convenient or conducive to the budgets of the organizations. And when I say that, it's not to cast the dispersions at other people's organizations. Some of ours here locally are the same way. We want to do a lot of work, and everybody thinks so. The issue I find with a lot of community work a lot of time is we want to do things in a fashion of what's most convenient for us. Right? What's most convenient for us, and what's more cost effective for us. The realization is sometimes it's not about what's more convenient for your organization and for you and cost effective for you and your organization. What's more cost effective for your community and what's more convenient for your community. And so a lot of it was that. It was utilizing social media too. All of the different social medias. I know a lot of our different organizations have communications requirements and guidelines that can be barriers. But the fact of the matter is, a lot of our men and people in our community, like they don't go to our organization's websites. I mean, think about it. If you didn't work for your organization, would you regularly look at your organization's website? So think about in terms of people who aren't in that. So people use Snapchat, people use Twitter, Facebook, Instagram, and also learning that those different programs or those different apps have different demographics. Like there are different age groups that pay attention or use those certain apps. So doing your homework and due diligence about knowing what's your target audience and what do they predominantly look at? What does that group predominantly look at to get their information, and making sure that you put information out, through those avenues, and not just one post a week or one post a day, but you have to make an earnest attempt and effort at it.
Oh, yeah.
That's great. Go ahead, Max. I'm sorry.
Go ahead.
Please go right ahead. So you're the guest. I'm just facilitating.
Really in agreement with everything he said, and more importantly, I knew coming into this role, I was coming in mid-COVID, and prior to that, a lot of the work had just disappeared, and it made me really sad seeing that. We were just doing school visits, setting up a table. I said, "There's no effort being put in here. There's no effort being put in here." And when the community sees that there's no effort, they really brush you off. And so making sure we put in that effort. And so, yeah, utilizing what you do have is an advantage, right? We're not able to do this in person, this conference in person. We have Zoom now. Let's utilize it. Not all our fathers can make it to every single engagement. We've realized that social media has helped us a lot, and so being able to just have what we have. But I don't know. I'm always going to throw that word consistency and intentionality. It has to be there. It has to be there.
Yeah, and thank you both. And I know that from working at the NICHQ, working with the Healthy Start communities across the country, what we've heard during the pandemic, just to add more to the answer to this questioner with regards to what were you doing before that was successful. And again, William, you hit it right on the head. It was when engaging men, you have to go to where they are. So that on the grounds, being able to go. So that community health worker aspect of the work of father was very important, because that was working, and being able to facilitate fathers connecting with their children physically. All of that left when COVID hit. So I think that's such an important piece to lift up again. It was being able to actually be on the streets, going to these places where men, like you said, Maximiliano, they're everywhere, but you just go where they are, right? Because you both have already said, we have, in this sector, we've rendered him invisible. So we just need to make him visible. And William, you said a word that I underlined, which is the first piece, in my opinion, around this work of fatherhood, is acknowledge that he's there, acknowledge that he has value. You have to do all that before you can begin making the place nice, include him. So it's deep work, as you both are alluding to, the training, the mindset, because we have questions about how do you change the mindset. It's all of that, and it gets deep because a lot of times it has a lot to do with how men and women have been fathered or not fathered. So dealing with the baggage and issues we have in order to make sure we make room for daddy. So this has been great. And so I'm looking at the time, and I definitely want to leave time for you two to have some closing comments. And I'm going to be selfish and save 60 seconds for Kenn to have something to say too. But I certainly want to see if there's more questions here. And so the mental health state of men, I know the CDC focused on this in the last few years, men and mental health, but can you all speak on the mental health state of men in relation to fatherhood? So really specific there. Again, the person says, I know women have a whole list of mental health issues during motherhood. What mental situation do you think men go through during fatherhood? So could you both elaborate a little bit on just mental health with men, particularly around fatherhood, becoming a father?
Well, yeah, for first and foremost, is let them know that mental health is a real thing. Not to sound disparaging to anybody, but that's religious. But I grew up in a community where when you dealt with mental health stuff, they told you to go pray on it. Nope, some of these things take a little bit more than prayer. So acknowledging that mental health is a real thing, and being patient and working with our men to do, to address that. For instance, fathers deal with postpartum depression, just like mothers do. And what it looks like a lot of times is either aggression or being aloof. So if you're a woman or a mom who doesn't understand that, it either looks like the father's either always mad at you or upset that the baby's crying, or it looks like he doesn't care anymore. And when you don't know that, it starts to create friction within the household and within the family, and oftentimes relationships can fall apart. But if you know that he's experiencing postpartum depression, you can be a refuge for him. Let him know that it's okay, and so when he is ready or does feel comfortable coming to you and dealing with that, he can do that. So that way is a trade-off, right? Because there's going to be some times where, to be quite honest, it ain't always 50-50. Sometimes it's 80-20. So when it's time for it to be 80-20 and mom's carrying most of the load and dad is being that 20 because he's dealing with his postpartum depression after he's put together and got his help, you know what I'm saying? And so that he can contribute fairly to the relationship. When she's going through hers, he's been there. He knows what it feels like. He can be the 80 without, being upset about it or feeling like she's not carrying her in, while her 20 is being spent on taking care of herself and looking after her so that she can come back and be her full, authentic self in the relationship.
Thank you. Maximiliano.
So I'm just going to talk out of experience.
That works.
The best tool I got. And just to be completely transparent and real, so I was 17 when my son was born, my firstborn. And throughout that year, my dad was in jail. And so, well, not that just that year, but he was already in jail since I was 14. And so that fatherhood piece was out of my picture throughout all these years. And since then, obviously, being first generation, he got deported when I was 19. And so it was going through these years without really having him there. Through a phone call is never enough. And so my mental health, and something that I've seen throughout a lot of my, just participants and clients, it's really just feeling lost. I felt so lost. And that experience just felt heavy on me. And the way I was able to handle it was, I just got to work. I don't got time to go crazy. I don't got time to mess up. I got a baby on the way and I don't know how to do this, but I gotta work. And so I killed it every day. Without thinking that I did have a community behind my back. I did, but I didn't see them. I wasn't there. It didn't come to my door to say, hey, you're a father, you're a young father, we're here to support. It wasn't there. And so it always felt like I was aggressive, or it always felt like I wasn't in the right mood, in the right state of mind, until I met my mentor at 19, which by that time my second boy was already born. But it was super, super, super intense throughout those years. Depression, I don't think I've ever really felt it the way I did until I had my child. And so again, no, our bodies don't change. Our ways of life does. Our ways of thinking have to change. But when we don't have the right people around us to support us and teach us the ways, it changes in a way that maybe even you don't like, but you're just going through it. And so you're moving with emotions. Even knowing how to be a father. I mean, I remember my childhood. I remember how my dad was at work from 7 a.m. till 10 at night. Like, I never saw it. And so it was, how do I just become this man that I'm supposed to become? at such a young age, I'm not in school, I'm not having the support I need. I work full time, and so it was mostly being able to figure out and looking for that support myself. But once I did, it was just so valuable. The way I started thinking, the way I started being, the way history was for me in general, it was just different. And so it was super important to be able to say, hey, and now today's date, right? Boa and Emilio have been there throughout my journey, and I say that fatherhood figure that I needed, and I'm super thankful for it. It's you guys, and without you guys, I wouldn't be here. And so just being able to have that support, the importance of support, of having a community around you. I had the pleasure of being able to kind of see both ends, and regardless of how difficult it was, that experience was super supportive. Now that I'm going through this new experience as now a community health worker. For sure.
Well, it's great. And thank you both for those answers. And Maximiliano, thank you for sharing of yourself as well. This has been terrific. I know for me, I would just say around the mental health piece. So Angela's my wife, and Angela and I lost our second son, Austin. And I almost lost Angela during that process too. So she could have been one of those maternal mortality statistics. But I remember when she was in the hospital and I was looking for support, similar to like you, Maximiliano. No one was around for me. I mean, people didn't even respond to me as a husband, father in distress because of his wife losing a baby and then having a child under one at home. It was the scariest time of my life, and I didn't talk about it for a long time. So one of the reasons, that was right as I was beginning to become part of Healthy Start 30 years ago. I was part of a community where this program was, and I was volunteering there, and that's how I ended up getting involved, because I would say there's nothing for men, and if I didn't get some support, I could have lost my entire family. But yes, I went through a lot, and I'm glad that there was support around me, as you described, that helped me get the help that I need to really get through, because my wife was literally unable to walk for 3 months. I had to carry her up and down stairs when she did come home, because we almost lost her. So again, we need that support, and I definitely underscore those that are looking to support men. The mental health piece is big, just as William started out. Now, William, you scared me in the beginning because you said you didn't want to offend the religious people, and I also happen to be a minister. I said, oh no, what is he gonna say? So I'm glad you didn't say prayer don't work. You say you need more than prayer, because I'm 100%, because I grew up in a religious where they were like, pray, pray, pray. I was like, I'm glad that I didn't believe that, and I went out and learned that we got to get people educated. Services. So thank you, sir.
Yeah, I just want to put it out there because I come from a family of pastors.
Yes,
and
more than prayer.
You know, there's some of us in my family who just think you don't need anything else.
No, we need everything else.
That's a whole other story, though, because, you know, as Black men, you know, we like to avoid the doctor or anything else as much as possible.
Same thing, yeah, medicine, science, we need it all. So, but listen, I want to give you guys, now you have 30 seconds each, but let me bring people back to both of you all, and I'm going to shout out a few things in just 30 seconds, and then let you guys take 30 seconds. But starting with William, he talks about resources for dads are limited. He talked about working with direct service providers, right? Fathers is a factor, right? And he's a doula and lactation educator. And because of the Wilder Foundation, doing what we want to see more organizations do is to make room for men. So that organization trained men to be first men to become doulas there. So that's awesome. Father is another person in that room, the advocate, he said, to help ensure the listening, to retain information as well. This is family work, he said, not just MCH work or what have you. He says, again, watching how society excludes him and changing that message. And then also he even made the connection of reaching early childhood milestones as we include dads. Validating fathers is what he said. And he said a lot of other things, but Maximiliano came in and just added on to that, says there's limited space for men and fathers. He also mentioned the exclusion of fathers and how we have to change that and make prioritizing fatherhood a priority and raise awareness of fatherhood work. He spoke a lot about the communication, marketing, etc. And his big thing was change the culture that we're in. And that's the work that he's involved in with the innovations. They said so much more, but those are the pieces that I got. And I want to say thank you to you guys. And again, 30 seconds each. Go ahead, William, and then Max, and we want to thank this great audience too, because they put some good stuff in the chat. Go ahead, William.
Yeah, just thank you all for taking the time out today. And like I said, always remember this: when you're working with men to address mental health or fatherhood, it takes more than one effort. Well, you know, when you're dealing with men who have a hard time accepting help sometimes, even though they need it. When you ask your child when they're hungry and they tell you no, do you never go back and ask them if they're hungry again? Think about that.
No, thank you to everyone. The questions, the comments, Will, amazing. Hopefully, you know, we can keep conversations rolling. But from my end, be intentional about the work you do. Be intentional about the work you do. And more importantly, the best we can do is show love. And that doesn't mean just showing love towards one specific parent, right? That showing love in general. Sometimes we don't feel that love coming in our direction just because one side of the story was said, the other side wasn't. And then here we go, we're already making assumptions. So just show love and appreciation in general. But thank you all for allowing us to be in this space. You're muted.
Thank you. I did that the first time. So I want to say thanks to you, gentlemen, and much love to both of you brothers, and love to our City Match community, our MCH community, many of folks on the call today. Thank you all for joining today. We still have a day and a half of conference left, so we look forward to seeing you all again, even on tomorrow. So thank both of you again. Jessica, team, thank you all very much, and everyone have a great rest of the day, and we'll see you all tomorrow. Much love to you.